I hope you guys are doing well. Am I audible to you guys?
Yes, ma'am.
Yes, you are.
All right, perfect. So I gave out an assessment to all of you, and you guys did really well. Um, some people did not perform, and some people performed, and they did great. And like I said, we're gonna do that assessment today in the class. So does anyone want to come forward and perform that? Dr. Zainab, you said you're gonna perform in the class. Do you want to do the performance?
Yes, I want Dr. Jaweria.
All right, perfect. So I'm sharing my screen. And do you need time to read it, Dr. Zainab, or is it okay if we just start the role play card?
Just 1 minute. I will just note down the
Yeah, that's
task.
fine. No, take your time. Take all 3 minutes.
Okay.
Okay, your time starts now. All right, Dr. Zainab, are you ready?
Yes, Dr. Jaweria. Hello,
Okay.
I'm Dr. Zainab, one of the doctor in clinic today. May I confirm your name and age, please?
Hi, my name is Jaweria. I'm 49 years old.
Well, Jaweria, I understand from your notes that you are suffering from rheumatoid arthritis. Is this right?
That's correct.
Can you tell me a bit more about your symptoms and which medications you are taking?
So, doctor, I was diagnosed with this disease a couple months ago, and I had this severe joint pain and fatigue, and I was taking some drugs which you guys call NSAIDs, I guess. Um, and I was doing okay-ish until 1 week
Mhm.
ago. I
Right.
just had this very bad flare, and then I just started to feel the pain all over again, and it's
Mhm.
just getting worse day by day now. I don't know what to do.
I'm sorry to hear about this, Jaweria. I know that you are suffering a lot. Can you tell me about your social habits like smoking and drinking?
Um, yeah, doctor, I do smoke a lot. At least 10 cigarettes in a day. I can't do without smoking. As for the drinking part, no, I don't really drink.
Right. And you have ever tried to cut down the smoking?
I did try, doctor, but it was all in vain. I just don't want to work on something that I could not accomplish, so I just stopped working on it altogether. And honestly, doctor, I just want this disease to go away. I don't just give me an aggressive therapy or a treatment that will just make it go away.
Right. Obviously, I can understand that you want to get rid of this disease, but I will explain a bit about the rheumatoid arthritis. It is a
Hmm.
long-term condition, Javeria,
Hmm.
and it means the symptoms comes and goes away. And if we take the medication regularly, then it will easy to keep this symptom in the sleeping phase. Are you with me?
Hmm. Yes, doctor.
But it is necessary to keep take the medication regularly. But there are also some other strategies which I will tell you so that we can keep your disease in the sleeping phase, or you can say the quiescent phase. Can we discuss that strategies?
Yeah, doctor, but why can't there could be a cure for rheumatoid arthritis? I'm understanding the strategies you're letting me know about, but I'm really not interested, doctor. I'm so sorry to say that. I just want this disease to go away.
I understand your concern, Javeria. You don't want to take the medication for a long period of time, and
Mm-hmm,
obviously it's very hard to take the medication for too long. But the thing is, it is a disease for which there is no cure. But the medications are there with which we can just keep our symptoms in a sleeping phase. When you will not take the medication, or you will not follow the exercises or hot massage or some treatment like these, you will not follow these treatment, then these symptoms will get flare up.
mm-hmm.
Are you with me?
Yeah.
So it's necessary to keep the these medication, and it is also necessary to follow all the remedies of rest, sleep, and also the modify your diet and do regular exercises. What do you think about it?
I understand your point, doctor, but it would still not make it go away, right? Yeah, I would still have to live with it.
Yeah, obviously, you will have to. I'm so sorry to tell you about this, but these strategies will help you to have a healthy and good life without any flares. And one thing more, most important, I would like to tell you that it is important to stop smoking. Or as you have already tried to stop smoking, but it is difficult for you. So there are many social services and the services in our hospital which will help you in stopping this smoking. If you like, I can connect you with these services.
Sure, doctor.
That's very good. I will refer you to these stop smoking services, and also I will make a referral to the rheumatologist, which is a specialist with this disease, which can also tell you more about this disease, and also will discuss the treatment remedies which are available for this disease. Is this okay to you?
Yeah, doctor.
Anything else you want to ask?
Thank you. Dr. Zainab, your time's over.
Yeah, thank you, Dr. Develia.
You did complete in the due time. It's not like you ran out of time, so well done for that. It was a really good performance. And just tell me one thing. Have you performed before?
Yes, I performed. In the
Okay.
first class, I performed with you.
Oh, okay. Okay. I could not recall. And when you sent it to me in the group, I was like, okay, this is a very nice performer, and I wonder why hasn't she ever performed in the class. But yes, it was really good. You were really calm and collective. You did not lose your demeanor. Although I was very aggressive and I was repetitive and I was annoying. But one thing that I liked about you was you were sympathetic throughout and you were in your demeanor and in your element of being cool throughout the whole um play card presentation. So good job. Yes, you did
Thank you.
forget to ask me how would I like to be addressed. Apart from that,
Actually, you told me just a single name, Jaweria. That's why I didn't ask this question.
yeah, so the patient will tell you a single name. Um, the patient will not tell you that, hi, I'm Miss Javeria, 49 years old, or I'm Mrs. Javeria, 49 years old. No, they're just gonna say their name, and then you're supposed to ask them how would they like to be addressed. And 95% of the times, they will tell you to just call them by their name. So, just as a sign of courtesy, you have to ask for that extra point.
Okay, okay, that's fine. I was assuming that if somebody tells two names like Zainab Aswar, then we should ask then how should I call you?
You have to call either ways.
Right,
You
right.
have to ask either ways. I'm sorry. Okay. Um, so yeah, that was really good. Uh, are there any new participants in this class who haven't taken this class before and they're new because I did see a couple new names. Do they have any questions? If you guys don't have any questions, then I would like to move forward. Okay, let's do another role play card. Okay, this is a really good one. Um I selected it for you guys. Does anyone want to go ahead and do this with me?
Hmm.
Who's that, please?
Dr. Jyoti.
Sure, Dr. Jyoti. You will get to do it if no one else does it because I'm just trying for a second to have other students come forward and perform as well. But you're definitely my backup.
Yeah, sure.
I can do it if you say.
All right, Hafsa. Same goes for you because you guys perform in each class, which is commendable, but I'm just trying for does anyone else want to come forward and do this? What about the boys in the class? Dr. Shazib and I'm seeing this new name. I think Jamil Khan. Do you guys want to come forward and do this? How will you guys perform in the real exam if you guys don't perform over here? Okay, Dr. Jyoti, you can go ahead, and then Dr. Afsa, you can do the next one if you want.
Okay.
Yeah.
Dr. Jyoti, when's your exam?
Saturday.
Is
I mean,
next Saturday?
after
Yeah,
4 days. No, this
after
Saturday,
4 days.
coming Saturday.
Yeah, yeah.
Yeah.
Good luck for that because I don't think you'll
Thank
be
you
able
so much.
to attend the next session. So
Yeah.
yeah, good luck. All right, so
Thank you so much.
no problem. You're good. Um, Okay, you have 3 minutes and your time starts now. Okay, are you ready, Dr. Jyoti?
Yes. Can
Okay,
we start?
You can go ahead, please.
Okay. Hello, I'm Dr. Jyoti, your attending physician for today. I
Dr. Jyoti, you're breaking up a lot. I could barely hear you. Can you please fix your connection?
Can you listen to me?
Yes, audible.
Can you listen now?
Yeah.
Yeah, okay. Can I start?
Yes, please.
Hello, I'm Dr. Jyoti, your attending physician for today. May I know your child's age and name, please? Name and age, please.
Yes, doctor, my child's name is Tanya and she's 9 years old.
Okay, so how may I address you?
You can just call me Jaweria.
Okay, Jaweria. Since I've already asked you about your child's history, and I've also examined your child, um, uh, would you like to tell me like what has brought you here today?
Since doctor, you know that my daughter just went through this major operation procedure where she had her tonsils removed last week, the tonsillectomy that you guys call it, and she was given this drug called oxycodone for her pain relief. So since then, doctor, she has been taking it frequently, and now she's constipated, and it's been 5 days. She has no history of constipation whatsoever, and her this constipation has triggered me in a way where I don't know what to do because she has never had it before, and it's just annoying.
Oh, I can totally understand that, and I really feel sorry. I would like, after listening to your history, I would like to tell you that your daughter's symptoms is most probably related to the drug that she's been taking frequently, that is oxycodone for pain relief. There is probably a link between oxycodone and your daughter's symptoms. Would you like to know anything else, please?
Yeah, doctor, what do I do about her constipation? How would I get rid of it?
Yeah, sure. I would like to tell you there are many effective measures for resolving this constipation. And I would also, as your daughter's symptom is most probably due to the pain relief medication that she's been taking, I would like to advise you for other alternative pain relief, which will probably resolve your daughter's constipation. Will that be okay?
So, you're going to give her some other drug now? We're not giving her oxycodone anymore?
Uh, uh, Actually, I would like to tell you that oxycodone has side effects that are common, like your daughter has presented, but usually it is mild and short-lived. So it's up to you whether you want to continue taking oxycodone or if you want, I can also prescribe you some other alternative pain relief for her pain. So how does that sound to you?
Yeah, that's fine, doctor, but I just think that my daughter really does need medicine because she is in pain after her tonsillectomy and that pain hasn't subsided. So,
Oh,
I want something,
yeah,
yeah, I
yeah, I
want
can
something
totally
very potent for
understand your
her.
concern.
Mhm.
Okay, I can totally understand your concern, and I can also understand it now. Understand that you really feel bad about her pain. So I would like to tell you that or advise you that you should try to be less liberal with the pain medication, as tonsillectomy pain usually improves after first few days. So uh, mm, she might not probably need much pain relief medication. So I would like to advise you to just limit the pain medication that you're using for her. How does that sound to you?
Yeah, doctor, that's fine. But what about if I have my daughter gargle with salt water, would that be helpful? And also, is it good for my daughter to have ice cream?
Oh, yeah, that's totally fine. That's a very good question. There are many benefits of ice cream, especially after tonsillectomy. Uh, as eating it will help the throat to heal, but you should look into it that she does not take quite increase amount of ice cream, as eating normally will help her to heal her throat. And also, are you getting me?
Yeah. Mm-hmm.
Okay, and I would also like to, as you had asked me about salt gargle, I would also like to tell you that it's a very good remedy, as it can help relieve a sore throat. But you should be cautious that she should not be swallowing it, and she should only be gargling it. Am I getting it? Am I getting you? Are you
Yeah,
getting me? Sorry.
yes, Dr. Jyoti, our time is over.
Okay, thank you.
Um, okay. So I do have a couple of concerns. You did perform all your tasks in time, but it was just in the nick of time. So I would um I would advise you to be faster in your exam,
Okay.
the one that you have, the real exam, the OET exam, speaking one that you have. Also, you did not ask my name. You just directly asked my daughter's name and age, which was the right thing to do, but um, you just directly asked me how would I like to be addressed. So that was kind of off-putting. So as I've told you guys multiple times that out of courtesy, just ask about the parent's name. Just be like, "Hi, I'm Dr. Jyoti, your presenting doctor for today. Can I please know your name and can I know your daughter's name and age?" That should be your question.
Oh, okay. So at the
ठीक है.
same time, we can ask the question at the same time.
Yeah, just ask a compound question covering everything because you don't want to waste your time asking, "Hey, can I know your name?" All right, can I know your daughter's name and age? You
Yeah.
don't want to do that. You're going to run out of time. So just ask a compound question. I've told you guys a couple times, covering everything in it. And then when she answers, "Hey, my name is Jaweria, my daughter's name is whatever, she's this much years old," then you'll be like, "Okay, is it okay if I address you by your name?" And she's going to be like, "Yeah." And then you go ahead. Because like I said, you're not invested in the attendant, in the parent. Your primary focus is the patient, the daughter, the son. So you don't really care about them, but just as a sign of courtesy, just ask their name to get it done with.
Okay, sure.
Can I ask a question regarding this scenario?
Yes, please.
As it's written that you have already examined the child. So we have to carry this task after examination, or we have to incorporate the examination thing in between the task?
So that's the question I was coming to. Like Dr. Jyoti said that I've already taken your history and I've already examined you. So yes, that's how you're supposed to present it, just like she did. That I've already taken your child's history and I've already done the examination, so you just come straight to the task because you know why they have done this? There's so many tasks to be completed in this scenario that you would not have time in the middle to be like, "Hey, can I examine your child?" So all the tasks they prepare are very calculative. They do cover the fact that okay, so in this particular task, can we incorporate examination or shall we just give it in the main stem and we focus more on the tasks? So that's exactly what happened in this scenario, and Dr. Jyoti did very well by coming straight to the task, and still she ran out of time. So that's how complex it's going to be. Some tasks require so much of your effort in the main points that they would not want you to take history or examination. They would just, like she did, she just said that I've already taken the history and I've already done the examination, so I would like to come straight to the main conflict.
Okay, thank you.
Yeah, no problem. But I do want to talk more about the task. There were a couple things, Dr. Jyoti, that you missed. You okay, so I would want someone else to perform this task as well because this is very important and we are missing a couple points. Um,
I can do it if nobody else is coming.
yeah, sure. Who's that? Dr. Hafsa?
Naima,
Naima. Okay. Um,
if
okay, just
Hafsa wants to do it, it's okay for me. I will do after Hafsa.
okay. All
Okay, I do
right.
it as you said.
Okay, can you please tell me who's performing it?
I'm Dr. Hafsa. If you want,
Okay.
I can do it.
Yeah, sure, Dr. Hafsa, go ahead, please. Do you need time to read?
No, it's okay. Hi, I'm Dr. Hafsa. I'm your presenting doctor today. May I know your name and your daughter's name and age?
Yes, my name is Jaweria. My daughter's name is Sarah. She's 9 years old.
I have already taken the history and your daughter, and I have already done the examination of your child. She is suffering from severe constipation. She is not suffering from severe constipation. Um, so, um, so what brought you here today?
Um, so doctor, my daughter, as you know already from the charts that she underwent tonsillectomy a week ago, and you guys prescribed her with oxycodone, and she has been taking it, but now she's been constipated for it's been 5 days. She hasn't pooped, and that kind of triggered me because it has never happened to her before, and it's kind of concerning to me.
Okay, do not worry about it because she is taking oxycodone and she do have symptoms because of that. Um, and it's normal, so do not worry about it. Well, there are different measures which you can try to relieve the constipation, and there are different things which you can try at home, which will help you in relieving the constipation.
Yeah,
And
doctor.
yes.
So shall I not give her oxycodone in the future because I don't think it suits her?
Well, it's okay if you don't take it, it's completely fine. The side effects with this oxycodone, they are common, but they are usually mild and it's short-lived. They will go away in no time, so do not worry about it. Um, and whenever the child has a tonsillectomy, the pain usually improves within few days. So it's completely fine if you don't take it.
But doctor, I can't have my daughter not take it because she's definitely in pain and I don't think she could survive without oxycodone or any pain drug.
Okay, well, you can try alternative methods. Like you can use ice cream. The ice cream, if you take it normally, it will help the throat to heal, and it will really be beneficial.
So you're saying that I should just switch like a drug with an ice cream, doctor?
Well, I'm saying that you can be less liberal with the medicine, and you can start using ice cream, and you can start taking medications less. Like the symptoms, they will go away in some time. So I don't think so that you should take the medication frequently. You should take it very less.
Doctor, is it okay
And
if my daughter gargles with salt water? Would that help?
yes, definitely that will help a lot. I mean, she can try the saltwater gargles, and they will help a lot to clear the throat. But you should not swallow the gargles. You just take them.
Okay.
Thank you.
Um, okay, is that it?
Yes,
Okay, you had 2 minutes remaining. Um, Dr. Hafsa,
yes.
you have performed in my class and you do really good. What happened to you? It was just
Um,
haywire today.
I don't know.
You are a really good performer of my class. You, Dr. Naima, you guys are like really, really good. What just happened? What became like, I was shocked. I was like, what is she saying? Like, uh, ice cream? Like, you can try taking ice cream instead of oxycodone? Doctor, so whenever my daughter has pain, like if she complains of pain like 10 times a day, I should give her ice cream 10 times a day. So what do you think you did wrong? I want to know from your perspective first.
I did wrong at the start, so I knew that I did it wrong because I didn't ask you how may I address you, and then then this that what has brought you here today. I didn't ask you even this.
Can I
So
make a comment?
Sure.
I think she did start very well, but she missed one point, which was recommend alternative pain relief. Since after missing this point, she got detracked, and she was again and again zooming around this point only. That's where she went wrong, what I think. So I think
who was this?
lesson to learn is that we should be reading all the tasks very carefully and should not be missing any point. Like only she missed this point, recommend alternative pain relief, and she went detract.
Yeah, and I think Dr. Hafsa, you did also in the beginning, you did something I couldn't recall. I was like, I'm gonna point this out. You were like, um, as I know that your daughter is suffering from severe constipation. Did you say something like that?
Yes, I said.
Okay. So, and then you kind of rephrased it, if I'm not wrong.
I said something like this, that I know that your child is suffering from severe
Mm-hmm.
constipation and I will examine the child. And
Fine.
then
You,
I said
oh, yeah, go
the
ahead,
child
please.
has no severe constipation, and then I said this.
Yeah, that's what I was wondering. I was like, what just happened there? Okay, and what else do you think you could have done to make it better?
Well, I should ask you first that what has brought you here today, and then
Mm-hmm.
I should say that I've already examined the child and there is no
Mm-hmm.
history of constipation, and then there is that oxycodone is related to the daughter's symptoms. It's due to the oxycodone that you have got this,
Mm-hmm.
and then we can try different alternative pain relief medications. We should say
Right.
this, that you can try alternative pain relief medications or something else.
Yeah, you could just say that I could recommend you some alternative um pain relieving medications that would have lesser side effect of this of putting your child through constipation, if you allow me to
Mm-hmm.
do so.
Okay.
Well, there was a point in my presentation where I was like, would I have to give her oxycodone um in the future as well? And is there any other thing that I could do for her? So at that point, you should just say that, okay, we could do this as well. And then you I was gonna ask you about the ice cream and the gargle thing in my next task,
Mm-hmm.
and you could have just commented on the ice cream part at that point.
Okay.
So, Dr. Hafsa, if you make a blunder in the beginning, which was not even a blunder, it was not that big of a deal. It's okay. You would have still passed. Never let yourself just leave all of it and just be like, okay, whatever. Now I'm not like, I don't even think there's any hope. Don't do that. Just pick yourself up and do so good that that one particular teeny tiny mistake that you did in the beginning would not even matter to the examiner. Leave such an impression that they just forget about whatever you did. Like it was not that big of a deal, honestly. You did forget how would you like to address me, but I was so invested in your presentation that I did not even notice. I wouldn't even lie to you.
Okay.
Okay, so yeah, when you perform next time in my class, I want you to be so confident that even if you make a mistake, don't let anyone notice it. Neither me nor anyone else in the class. Be so confident in your demeanor.
Okay.
Okay, perfect. Um, who wants to perform now?
Me?
Who is me? Dr. Naima?
Ji,
Okay. Dr. Naima, do you want to do the same task or do you want to do a different one?
as you like. What do you
Oh,
suggest?
let's do a different one. We have a lot of tonsillectomy.
Mm-hmm.
Okay. Is this the same case, the tonsillectomy one? Yeah, it's the same one. Let's do this one. This is a good case. Okay, you have 3 minutes, Doctor. Your time starts now. Okay, Dr. Naima, do you want to start now?
Okay. Hi, my name is Dr. Naima. May I know your name, please?
My name is Jaweria.
Jaweria. I am your treating doctor today. Uh, how can I help you?
So, doctor, I'm here for my son.
Okay. How old is he?
He's 16.
And what happens to him?
So I'm suspecting, doctor, that he is taking drugs because I did find marijuana equipment and it was hidden in his room. And I'm extremely, extremely worried because I talked to him about it and he's not willing to see a counselor and he just totally denies that a problem exists. And I'm extremely desperate for a solution, so I just came by myself. He didn't even come today.
Well, Javeria, I can understand that as a parent, how much worrisome it would be. That's why you came alone. Uh, can you please tell me that what makes you think that your boy is taking some illegal drugs?
So, doctor, his whole demeanor is so different now. He stays in his room, he sleeps all day long, he just complains of being sick all the time. He has lost weight, he does not attend school. Um, he's a loner now. He used to be such a good social child, and now he does not even have any friends. So yeah,
You go ahead.
yeah, just all these things. They just make me worried.
Well, you seems to be a very good parent because you are keeping a very close eye on his habits. Can you please tell me that have you probed ever about his friendship? What kind of friends he is having nowadays?
Doctor, nowadays he does not have any friends. He's just a loner, and he just stays in his room, so nobody comes in, nobody goes out. He is not hanging out with any friend, as far as my
And
knowledge is concerned.
well, how about his study? Is he doing good, or he is as performing as he performed always?
He, like I told you, he does not go to school anymore. He just makes an excuse for not attending his classes.
Okay, thank you for giving me all the information. I want to ask you about that how you would like to do it. Whether it would be possible for you to bring the boy to me to see me in person, as the boy is quite adolescent. He is 16 years old. So what do you think? Would it be possible for you?
I could try, doctor, but I'm sure he's not gonna like. He's not. He's not willing to get out of his room. But what could you recommend, doctor, to help my son?
So let's work together on this issue. I would suggest you that I would refer the boy to an adolescent psychologist for assessment and appropriate treatment. Sounds doable for you?
And what would be that appropriate treatment, if I may ask?
He would be making assessment, taking history, and he would be counseling the boy, and he would be in better position to give appropriate treatment. So it would be a better choice for us at this point in time. What do you think about it?
Yeah. Um, but
And
doctor,
Miss Javeria?
I would like to know how marijuana affects young people. Like,
Yeah, let me
what does
tell
it
you
do?
about some effects of the marijuana, that it can affect the alertness, concentration, and coordination of the person who is taking it. So you have to be very cautious and keeping an eye on all these things. Do you get my point?
Mm-hmm.
So anything else you want to ask me about it?
No, not really, doctor.
So here is a leaflet which is having all the information about the illegal drugs. You can read it at comfort of your home. You can go through it, and you can read all the side effect of marijuana and signs of the toxicity of this drug. So this would make you enlightened. And if any help is needed, you can always contact me. I'm glad that I was able to address your issue, and I'm referring you to the psychologist. Goodbye.
Okay, thank you, doctor. Okay, we're done?
Till time left? Yes,
No.
I'm done.
You're out of time. Okay,
Okay.
but you're done. You did finish it in time. Okay, so Dr. Nama, you did good. Um, but it was the same mistake that you all have been doing with these cases that has a child involved in it, that you guys are asking um like a couple questions. So you asked me for my name, and then you asked me for my boy's age. You did not even ask for his name.
Mm-hmm.
Do you recall doing that, Dr. Naima?
Yeah,
Yeah.
I
So
missed
how
that.
can you rephrase that question again for me? How would you have asked?
Okay, as you said, that boy is not here, so I would be asking that how old is he and what's his name?
Mm-hmm. So you would have come in, you would have said, "Hi, I'm Dr. Naima, your presenting doctor for today," and then shoot. What would be your another question?
How can I help you? So uh, the interlocutor would be saying that I came to see you about my boy, and then I will ask that how old is he and what's his name? How can I
No,
address him? How would you like me to address him?
no. So your question would
Mm-hmm.
be, what's your name? What's your boy's name and age? And then it would be a quick compound question. I would just give you a quick reply, and then you would have been like, um, is it okay if I address you with whatever your name is? Like if I said Javeria, is it okay if I call you Javeria? If I address you as Javeria, and I'm gonna be like, yes. And then you just go
Mm-hmm.
ahead, right? So a quick compound question covering everything in it.
Okay.
Okay. Apart from that, it was a couple grammatical errors here and there. Apart from that, it
Mm-hmm.
was good. Um, one thing you did was you said you seems to be a good parent. That's you
Mm-hmm.
seem,
Wrong. You seem to be.
yeah, you seem to be, and it was good that there was sympathy and there was appreciation and all of these elements were present, but just a little bit of grammatical here and there.
Mm-hmm.
Yeah, it was all good. Um, you did great by digging in for his lifestyle and about all those questions. You did great, and then you gave out your assessment. Um, yeah, it was good. It was great, and you did finish in time.
Okay.
Yeah, it was really good. We can do one more case before we wrap it off. So, who's gonna do the presentation?
May I, ma'am?
And can I please?
And can I please?
Oh
My
yeah.
name is Tarha.
Mm-hmm. Yeah, sure. You haven't. I don't think you have performed before.
Yes.
So I'm giving you guys another case for the child case. So for better practice, you have 3 minutes. Doctor, your time starts now for reading. Okay, do you want to start now, doctor?
Yes, no. Hi, I'm Dr. Tata. I'm treating Dr. Foles today. May I know your names and your son's names and age, please?
My name is Jaweria. My son's name is Alex, and he is 3.5-year-old boy.
How may I address you?
Just Jaweria is fine.
Okay, Jaweria, what brings you here today?
So doctor, my son is now 3.5 years old, and he has not been potty trained, and I've been trying for the longest time. I have other two kids as well, and they were toilet trained when they were his age, actually before that, and I haven't been successful with him, so that's what worries me the most.
Okay, I know you're worried as the parent, but since your son is still 3.5 years old, it's still young, and you need to be patient. It's probably quite ready, not ready for him yet. So, and is there any other symptoms that he has, like any stomach pains or constipation?
No, doctor. He is healthy and he's otherwise normal, but just the fact that my other two kids were potty trained by this age kind of ticks me off because I just I don't want to have something else being wrong. I don't know if everything's okay with him. I'm just worried.
Okay, I know what you are worried, but that late toilet training is not abnormal. Some maybe earlier and some maybe late. So, what techniques have you been using to train the toilet to the point?
Um, Doctor, I've been using the same technique that I used in my for my other two kids. I just encourage him to go sit on the seat and I take him at regular times of the day and then I tell him to pee and poop. And that technique, doctor, worked for my other two kids, but it's just not working out for this one.
Okay, I would like you to suggest to try some alternative techniques like a reward system,
Mm-hmm.
involving you can also encourage your older children to encourage him, but do not punish or nag the child because he is still too young.
Mm-hmm.
And how about showing him some videos and using books and what he likes to do, and you can reward him with toilet training. How about trying some alternative techniques?
Yeah, doctor, I can definitely try that one. But what if he's not potty trained by his by the time when he has to go to his kindergarten? Because over here in the country that I live in, they have a strict rule that if my child is not toilet trained, they would not have him sit in the kindergarten. So what would I do then?
Yes, it takes a little time because he probably not quite ready yet, but mostly it will he will he will do that when he is ready. So there will be so much big problem. You need your time to. How about trying with that alternative techniques?
Okay.
I think it will probably be solved.
Mm-hmm.
Yeah. Yes. Do you have any questions?
No, doctor, I'm good. Thank you.
Thank you.
Okay. So Dr. Your presentation was the introduction was phenomenal. Good job on that. You shoot a compound question at me and it covered everything. And for all of you guys listening over there, please make a note of this is how you're gonna ask when you would have a. She was so quick and so spontaneous, and honestly, it was the best introduction so far I've had in my class about the case which involves a child in it. So good job for that.
Thank you, ma'am.
Okay, apart from that, everything was good. You did talk about reward program, which was necessary. Um, you did tell me that some kids take time. The only thing that I think was could have been done better was the fact that when I asked you about the kindergarten thing, so I had this task written in my role play card that I was gonna ask you this question, And to answer that, you whirled around the same like alternative technique method and all of that stuff. So now, do you have anything in mind that you could have said before to counter my question?
In kindergarten,
Mm-hmm.
how about using Thai bus? Not like that.
What could have you said to make me feel better about? Because I was worried that my son, when he goes to kindergarten, would not be toilet trained, so they would not take him.
Mm,
You did great. Like you did really, really good. But it was just this one question that was, um, when I asked you this question, you said you repeated your theory of trying alternative techniques and um
should I say he will pick up necessary skill when he is ready, like that?
yeah, you could have said that too.
Mm,
And so what we do over here is we reassure. So reassurance is also an integral part of the entire assessment. When it's needed, it's needed. And you just have to reassure the mother by saying that it would happen by the time your child would need to go to the kindergarten. You just have to hang in there and just do what I told you, and definitely he would get in the hold of it. Or
mm,
else we can definitely come up with something else,
okay,
So just a little bit of reassurance.
okay, yes.
Apart from that, it was perfect. Um, so thank you for trying, and I would want you to try in the next class as well, please.
Yes, ma'am.
Thank you. Does anyone else want to come forward and answer that question of mine that when my child will go to kindergarten, how would he cope up with it? Is there a better explanation for that? Do anyone of you guys want to do that? Dr. Naima, Dr. Hafsa, anyone?
Sorry, what is the question?
So the last question in the task that I asked, which was my son would have to go to kindergarten next year, and I want him to be toilet trained by that time. So what if he's not toilet trained? What would I do then? So what would have been a better approach to that question? Would anyone like to answer on that one?
Is this
Well,
the fourth task?
Can I?
Yes.
The fourth one?
No, it's the last one. I think it's the fifth one.
Okay. We can suggest them that if he is not yet toilet trained and he's
Mm-hmm.
having problem in passing stool, what you can do that you can introduce to him a reward system that as he passes stool, you can give him some of his favorite food or candy what he likes, and it's good thing that you are having older children as well, so you need to involve them as well. When they are going to the toilet, you can suggest your little one to go as well, and please keep in mind that never punish your child or nag your child for not passing stool, and you have to discuss this issue with the child in form of books, or you can show them video on mobile or tablet, and you can always encourage them to encourage him or her to pass stool this way.
Thank you, Dr. Naima. But she did cover all of these points in her presentation. And it was what you were talking about was task 3 and 4. So yeah, she
well,
did
what I
cover.
can do, that we can reassure the parent that
Yes, that's what I said about the
is left and
reassurance.
more than enough for him.
Mm-hmm.
It's
Was
1 year still. So
yes, yes, he still has 1 year to go. So reassurance
the
would be
child
the
will be
answer.
the necessary skill. Well, fine, do not worry about it.
Perfect. Yes, that's gonna be the answer to the question. Thank you. Was it Dr. Hafsa?
Can you please
Yes.
repeat it? I was not able to hear.
Yeah, sure. So who gave me the answer the last time? Was it Dr. Hafsa? The
Yes, I
one,
gave.
yeah. So that was the correct
And Dr.
answer.
Hafsa.
Okay. So see, Dr. Hafsa, you have it in you. You don't have to get
Yes.
like all. Okay. So this was the question. 1, 2, 3, 4, 5. This is the fifth task that I had. Express concern that your son will not be toilet trained when he goes to kindergarten next year. This is the question that I asked. And this was going to be the answer. Reassure the parent that his or her son will pick up the necessary skills when he's ready. So over here, reassurance was required. And like Dr. Hafsa said, because we have already talked about the reward system, we have already talked about the older children being involved, we have already talked about the fact that do not punish your child, he'll do it when he's ready. The doctor who presented the case, already covered all of these points very well. Now we just have to reassure the parent by saying that he still has 1 year more to go and he would definitely get a hang of it in that time frame. So just don't push it and hang in there. He will definitely and for some more gravy, you could add up that if it doesn't happen by that time, we would definitely come up with some other skills or something else. Just don't worry, just don't push it. Don't be too hard on yourself. So just a little bit of reassurance. That's it. And then you're good to go. Is that okay?
Mhm.
Okay, perfect. So all the presentations today were really, really good. A lot better than the other two classes that we had. Um, and thank you to everyone who performed. I would be going to give out one more assignment this week, and all of you guys did really good at the assignment as well. But in this assignment, the only thing that will be different would be you guys would have a fixed submission date because it does become difficult for us to look up for the voice recordings and to listen to them and to reply to them. And sometimes I forget, sometimes I just get busy in my own thing. I'm not able to respond for a couple days. So I'm gonna give out the assignment today, and you guys have till Thursday, 8 p.m. to complete that assignment. Any submissions after that time would be voided. They would not be accepted. So Thursday, 8 p.m. would be your guys' submission time. You guys have 4 days to complete the assignment and submit it, and then I would assess it on Thursday, and by midnight, I would give you guys the assessment. Is that okay?
Yes.
Perfect. Okay. So I'll give an assignment out in the group, and thank you guys for joining. If you guys have any questions for me, please shoot them in the group, and I will be happy to answer. So thank you guys, and bye-bye. Take care.
Thank you. You too. Take care.
Okay, bye-bye.